Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. This is the patient information I give patients when talking about vitamin D deficiency. As we saw with the COVID pandemic, when your body is exposed to infections, your first line of defense does not come from medicines, urgent care visits, emergency rooms, or even your primary care doctor. Your first line of defense is yourself and the things that you have done to prepare your body to combat illness. Boosting your immune system is one of the most important jobs done by vitamin D. It's also a modulator of energy, helps us combat fatigue, and is a general anti-inflammatory. When you have chronic conditions such as asthma, low immune system, or inflammatory bowel disease, a vitamin D level that is low leaves you vulnerable to complications and everyday infections. That's why it's important to optimize your vitamin D level. A normal vitamin D level is 30 to 100 and an optimal level is 50 to 60. Most people I check run in the 10s to 20s. Milk has been supplemented with vitamin D, meaning that vitamin D has been added to the milk, and in my opinion, anyone aged 2 and up does not need milk. If you think about it, most mammals in the wild don't drink milk past infancy. As you age, milk can actually be bad for you. Many people develop lactose intolerance, which is diarrhea, gas, and abdominal pain due to milk sugar, and the milk protein can worsen conditions in vulnerable individuals, especially those predisposed to allergies and asthma. In children, I especially dislike milk because it can lead to anemia by binding iron and preventing the gut from absorbing it, and it fills them up, decreasing their appetite because instead of eating food, they drink milk all day. So in my opinion, milk is not a great source of vitamin D. There are some juices that are supplemented with vitamin D, but the sugars in the juice can coat the teeth and predispose you to cavities. And in children, the sugar gives them energy and takes away their appetite. And if you know me, you know I always say, no juice, no soda, no cereal. The sun is the only natural source of vitamin D. It penetrates the skin and causes a reaction that increases your vitamin D levels. But many of us are genetically predisposed to having low levels. In addition, people who have fair complexion or people of darker complexion will have difficulty in absorbing and metabolizing vitamin D. When your vitamin D level runs low, yes, you should get sunshine, especially early in the morning before 10 a.m. or after 5 to 6 p.m. But you should also supplement vitamin D. Before you start a supplement, you should make sure you need it. Vitamin D is one of the fat-soluble vitamins. If taken in high enough quantities, it can poison your liver. I check vitamin D levels anytime I'm doing well labs. Those are routinely recommended in early adolescence around the 11 to 12-year-old physical. I also think about checking levels in my asthmatics, my kids with allergies, my kids with runny nose, my kids with chronic infections, my kids that have underlying autoimmune disease such as Crohn's, ulcerative colitis, thyroid issues, lupus, any fatigue workups, and anyone predisposed to metabolic syndrome due to poor eating habits and a lack of exercise. So basically, anytime I'm drawing a central lab, I'm adding a vitamin D level. This is a central lab draw. That means you have to go to the lab, and it cannot be run at your doctor's office unless they draw labs from the vein. I supplement vitamin D first and foremost for exclusively breastfed babies. Ask your pediatrician about dosing, but I usually recommend Gerber Soothe. I recommend everyone take a multivitamin, like Smarty Pants. Just make sure you brush your teeth after, since it is a gummy. Even my 17-year-old loves them. It's the only vitamin I've seen so far that has vitamin D, zinc, and omega for kids. All great immune boosters, all in one. For older kids, I use thorn or forest leaf, depending on the level of deficit. Capsules can be sprinkled if necessary, and if the patient is old enough and tolerates it, I prefer the forest leaf, since it can be dosed once a week. When choosing a supplement, always choose vitamin D3, which is better absorbed. And beware, if your vitamin D level is low and you need to supplement, most likely this will be a lifelong need unless you completely change your lifestyle and are out in the sun more often, but that will increase your risk of cancer.